Coping with your pet's cancer is challenging enough. With only about 450 boarded veterinary oncologists in the US and Canada, what do you do without access to vet oncology services near you? Learn all about remote pet cancer care consulting with Dr. Rachel Venable on this episode of Tripawd Talk Radio. Welcome, and thanks for listening to Tripawd Talk Radio episode number 106. The video version of this and all previous shows is on our Tripawds YouTube channel. We're excited to be speaking with Dr. Rachel Venable today about how pet cancer care consulting makes treatment more accessible than ever for everyone. Dr. Venable is a board-certified medical oncologist who obtained her veterinary degree at the University of Missouri. She completed her residency at the renowned CSU Flint Animal Cancer Center in Colorado, and she's founded Pet Cancer Care Consulting Service as a way to help pet owners who want to consult with a veterinary oncologist but may not be able to access one in their area. This means that anyone can consult with a board-certified oncologist and their vet to discuss the best treatment plan for their pets with cancer wherever they are. Dr. Venable, thank you for what you're doing and welcome to the show.
Thank you so much. It's a pleasure to be here.
We are so excited to tell everybody about what you're doing for so many reasons. And it all goes back to our story way back. But one of the reasons that we didn't do oncology for our dog, Jerry, was because the closest oncologist was 6 hours away. And this was before Zoom. This was, it was in the baby days of any kind of internet video
2006.
chats. It was 2006. Had we had a service like this, I would have definitely taken advantage of it, because one of the best things that pet parents can do if they get the bad news about a cancer diagnosis in their pets is to at least get the information. Even if your gut reaction is no way, no how, I'm not going to do that for my pets. Get the information so that you can feel good about that decision and not second guess yourself as time goes on, because we did a lot of that. We definitely did a lot of that. So Dr. Venable, enough about me. I want everybody to hear about you. Tell us a little bit about yourself and your career in veterinary oncology.
Oh, well, thank you. And I agree with you. I think knowledge is power, right? No matter what you do with it, just knowing it gives you so much more comfort. And just, I find people just calm down, after that consult, whether or not they decide therapy or palliative care, you can tell they calm down. But going to my story, so I'm actually a farm girl. So I grew up in the Midwest, out in the middle of nowhere. So always been around animals, and so kind of, gravitated towards veterinary medicine that way. I had no idea about specialties. I didn't know there's oncology or anything. Like I said, I grew up in rural Missouri. So I guess the nearest oncologist where I grew up would have been about 3 hours away. So kind of a similar, there was nobody like that. So in vet school, that's where I found out more about oncology and really got interested in it there. And a lot of it was somewhat the medicine side of it. I really liked just all the research, and it was just so fascinating. And the One Health approach, so how humans and dog cancer is actually fairly similar, and how we can get therapies to help both. So really got excited about that, and also helping people. So I find when your pet gets diagnosed with cancer, you just feel helpless. You don't know what to do or where to go, and so I think stepping in as that person of trying to help, provide empathy and just sort of a guide, whatever path they choose. I also really enjoyed that, just trying to help people in, kind of a helpless situation. And from there, as far as kind of my journey, as far as education and things, I guess you kind of already went over all that. So yeah, I did my internship and residency, and then I've been working in private practice for several years, and just recently started the teleconsulting, the pet cancer care consulting.
So I'm curious, you say recently, did COVID have a big play in this role to go remote?
It did. I don't think I would have thought of this concept before COVID. I think with COVID, Zoom, became a thing. It's like a verb now, and I didn't know about it pre-COVID. And so I think with COVID, it really brought to my mind just how people are more accepting of video chats and remote conversations, where I think before, maybe not as much, I certainly wasn't familiar with it outside of like short Skype meetings or things. So, and also with COVID, and it had been building up, but it certainly got worse of just the wait to come in to see me. I mean, that was what got really frustrating, is I just, everything trying to do, but there was still this really long wait. And then also I knew there were lots of clients falling through the cracks between that wait or the drive, like you guys were saying, it's just, they're so far away, or, clients that just get, immediately sort of unsure if they want to see the oncologist because they feel like they have to jump through all these hoops to even get to one. So that was the other, real thing that brought to my mind of there's got to be a better way. There's got to be another way to reach more people. There's just so many dogs, unfortunately, and cats that get cancer, and there's just really not that many oncologists. There's something like, I want to say it was the American Cancer Institute or the National Cancer Institute, said about 6 million dogs a year are diagnosed with cancer. And there's actually less than 450 boarded veterinary oncologists in the US and Canada. So clearly there's not enough of us.
Wow, that's including Canada. That is,
right.
Whoa, because I know that when Jerry was diagnosed, I think there was just barely 200 oncologists, and that was a long time ago. So you would think that there would be more right now, but unfortunately there isn't. And so I'm just in awe of what you're doing here. And tell everybody exactly what you're doing with this model of veterinary oncology consulting.
Yeah, so what my model is basically trying to partner with the family vet to try to reach more of those clients that aren't getting reached, for the reasons I mentioned, either the drive, wait time. Sometimes people too, they're not really sure if they want to see the vet or not, and or the oncologist vet, I should say, but they keep asking their vet tons of questions. They keep calling and asking, and and it's just not fair for the family vet. They can't know everything about everything, and oncology certainly changes all the time. It's a lot just for the oncologist to keep up with it. So what I do is basically from my website, which is www.petcancercareconsulting.com. So from there, it really, describes everything, but also vet clinics can make an account. So there's a vet portal. So vet clinics can make an account, and then from there, they can actually schedule and upload records. And so it's a great way for us to communicate. And once somebody's made an appointment, what that day looks like is I would have reviewed the records. So I touch base first with the vet. So the vet and the pet owner are actually there at the clinic. So it's kind of like a recheck exam. And so I talk with the vet just to make sure, and the pet owner's there as well, like I said, so kind of making sure like I've got the right idea of what's going on. I have the vet do a quick exam of the pet so I can see them and also make sure, like the tumor's not coming back or there's not big lymph nodes, those sort of changes. And then I talk really in detail about the cancer, go through, testing, treatment, prognosis, all those things. And it's something where, the vet can definitely stay in the exam room that whole time, or sometimes they have to pop in and out because they have other appointments or that kind of thing. And that's fine. But I really get to talk with the owner in real time. And so that way they can ask me questions. And I also type up notes while I'm doing it so they can kind of follow along, because it is usually a pretty long, detailed conversation. It's a lot to follow. So I try to make it as easy, as you can. And then I also afterwards type up really detailed summaries and handouts. So I give those both to the vet clinic and the pet owner directly. And then I'm also available afterwards if they would like detailed treatment protocols or just follow up, things change with the pet, or if they want me to look at images, that kind of thing. So I'm available to help kind of, again, partner with that family vet and follow along.
You said something important there about how general practice veterinarians can't know everything. And so many people trust the family vet, but I think it's important for everyone listening to know they can't know everything, and they don't have specialized training in oncology and reviewing radiographs and that thing. So I think that's really important reason to do these visits. And I think it's great how you're visiting with the vets and the patient and the client all at the same time. So thanks.
Now, just to clarify, also, does the veterinarian actually do the treatment themselves? And who is the ideal veterinarian to do this kind of thing?
Yeah, that's a great question. So it depends. So I would say a lot of times the vet will do the treatment depending on what it is. And I think sometimes too, the stigma is the only treatment is IV chemo. And, there are situations where IV chemotherapy is the best for sure. But there's a lot anymore where there's good pill options. I think pharmaceutical companies are finding that's sort of the way of the future. I think even in people, people like pills. And so that's what they're doing more with dogs. So there's more and more pill options. And so a lot of times, family vets, I think, feel a little more comfortable with that too, because they don't need any special equipment for that. And I go over with the owners, all the safety precautions with handling and that kind of thing. And IV chemo, it depends. So there's some family vets that will do that and they're set up for it. Otherwise, we partner with other local oncologists. So, I'm here in Arizona, and so there's a local oncologist that if clients do the consult with me, she's actually able to get them in a little bit sooner for IV chemo as like a drop-off type appointment. So that'll be something in other areas, see what we can figure out, as far as what works with the other oncologists, structure and things. So I certainly, want to do this service outside of just Arizona. I see it as something for the whole country. So that's where the IV chemo, it can get a little bit more tricky, but it certainly isn't the only thing. And the ideal vet, I would say, for this is really anybody that is looking for that next level of care for their clients. They want to practice good quality medicine, and they can really partner with an oncologist. I mean, that's really the way I see it, is a partnership. And a lot of times this actually can bring revenue to their clinic because they're doing different testing or different treatments, like I said, whether it's pills, and sometimes it's palliative care, adding in other pain medications or maybe antibiotics or things they just, hadn't really thought of before. And a lot of times after the consult, especially with the clients being there, a lot of times they actually decide to, I want to go ahead and run this blood test, or let's sample this, lymph node or other mass or that kind of thing. So it is something, I think, for the vets. It's not just being able to practice a higher level of medicine, because you're partnering with an oncologist, but it can also bring some revenue to your clinic by doing testing and treatments that you might not have otherwise done.
Oh, totally. And for the pet parent, it's really nice that they have these people collaborating in real time, because so much misinformation happens when the information gets passed back to the specialist later on. So after the visit, so somebody goes to see their primary care vet and they say, well, we'll review it with your, your orthopedic vet or your oncologist. And then there just seems to be this lag of communication and miscommunication that happens. So I like that you're actually talking to them right there and building this relationship. It's like having all these brains working on your pet all at once. It's a really neat sounding thing. Now, do you also consult in the areas of immunotherapy? Because I know there's a lot that are coming out now that family vets can administer, but is that an area that you're also consulting in?
Yes, I think immunotherapy is great. We've got the melanoma vaccine. There's always new technology coming out. Toragen is a new one that came out. And they're really doing some research. I think some of the immunotherapy, and with anything new, I think you always have to do your research, because there's some companies that make pretty wild claims that they can cure cancer, but then you can't find any published research. It's all in-house and they won't really give it to you. And you look at the website and it's like, where are these numbers coming from? But Toragen, I like them. They really are trying to publish, and they're kind of adding an extra step to that. So, because some of the immunotherapy, the vaccine technology has been around for a long time and hasn't really taken off. And so I think it's that, trying to add a twist to it, trying to do different things to how can we stimulate the body.
Yeah, definitely. We learned a lot about Toragen and immunotherapy on a previous Tripawd Talk podcast, where we talked to Dr. Michael LaCroix from Toragen, and we'll put that link in the show notes so people can catch up on how all that works. But that's why I mentioned it, because it's really cool that we can bring in our regular vet. I think so many people are so much more comfortable working with them. And for them to be a part of the team, even after a cancer diagnosis, it can be really comforting. Now, can you give me some examples of some patients that you've helped recently? I know your service is pretty new, but can you think of one or two that you're working with that, you don't have to give away patient confidentiality or anything like that if you don't want to, but I'm just kind of curious.
Yes. So some examples that definitely come to mind are, I saw a dog with a pretty bad bone tumor. It was actually on a rib and wasn't resectable. And so, it's painful for that dog to really have to move around too much. I mean, because they lived actually a few hours. It was about a 3-hour drive. So between having a painful bone tumor and just even, 3 hours one way for a client, that's a long time. So that was definitely one where we were able to help with some pill options actually with that one. And there's been a few others where it's kind of that long drive. They really didn't want to do it. And then there's another one that comes to mind, a dog that had a really aggressive lung cancer, but actually couldn't get in anywhere for about 3 months. And so it was something where I think the owner just kind of got beat down and sort of stopped trying a bit, and then I had talked with her vet, and so they learned about my services, and she was very excited, just getting to get more of that information. And again, we ended up actually doing another pill option. So there's, a lot of those different pills, and, still IVs have a very big role, but I think sometimes, like I said, there's a lot more out there that we could do. And some of those guys where, like that poor dog, she just couldn't get in. And then I've definitely seen some where I could tell the clients just had so many questions, but they were kind of nervous about seeing an oncologist, and you could tell that they're just comfortable there with their family vet. And like you mentioned, people do really like that they see us talking in real time. And I think it helps really with that continuity of care, because I can directly ask, because there are some things in the notes where you could kind of, it's up for interpretation, or maybe in my mind, I see it differently than how they meant to write it, or vice versa. And so it is nice, because even in human medicine, one of my kids actually got pretty sick this summer, and seeing all the different doctors, and there were times where it was frustrating because it was like, I don't think you guys are on the same page, like nobody would prescribe. She actually had a bone infection, and nobody would prescribe a pain medicine, and she was in so much pain. But it just seemed like they were all nervous, and I get it, NSAIDs with kids, but there was you could tell there was a disconnect because nobody was talking. And so it is nice with this, even just being, the specialist and the vet that's directly with that client, being able to talk in real time, and the pet owners there, because sometimes they bring something up and you're like, oh yeah, like that wasn't really in the record, or this has changed. And so it is nice having that three-way conversation.
So many clinics and teaching hospitals right now are backed out so far. I think one of the greatest benefits of what you're doing is being able to see the local family vet and still consult with a specialist, because oftentimes time is of the essence in these cases.
How is your daughter doing now? I hope she's better.
Oh, she is. She's back to normal. You would never know, but it was, I appreciate that. But it was a little bit of a stressful time, but she's all good now.
Oh, that's great. Well, they should have known that you were on the case, and we're gonna fix things right. So now I understand that prior to the pandemic, there was this issue with the AVMA not allowing long distance consulting with veterinarians and pet parents. And I thought I read somewhere that they relaxed that rule, that now, there's a name for it, and I'm sorry, I can't remember it, but that now this type of service is definitely allowed. Are there places where you still can't practice this consulting, or are you wide open to the US and Canada?
So for the most part, I believe I'm wide open to the US and Canada, and the difference being, but having said that, I have a lawyer, and we do check every state. So it's something I certainly double check. So it's something where I believe I should be fine, but I do my research at the same time. So the reason I think I'm fine is because that client-patient relationship, that's the big thing everybody always talks about. And so, a vet-to-vet conversation, the consultation, that's generally fine, even across state lines, because like radiologists, they've been doing that for a long time, or radiologists, I mean, sometimes they're not even in the US, right? But they're just digitally reading radiographs and can talk back and forth. And it has always been something where you can't necessarily talk to the client and give detailed information unless you have that client-patient relationship. And so what I'm doing is, because I'm partnering with a family vet who has that relationship and they're part of the conversation, that's how I'm able to help, talk to the client and give them details about their pet's disease. So it's because I'm consulting with the supervising vet who's in real time, all right there. So it's not a situation where I would just talk to the client without the vet. There are some states where you could get that client-patient relationship remotely, but to be honest, I want the vet involved. I think it's better medicine. Even for me, I like to make sure, what the vet's seeing and just partnering with them. And also, I can't prescribe medication to these people I'm talking to. And again, I really wouldn't want to. I really want to make sure we're on the same page with the vet and having the vet involved. I think it would get so confusing if it was a separate thing and then the client comes to the vet and they're like, well, this oncologist online put me on this. And it's like, oh, that's just,
right.
That doesn't seem right.
Yeah, definitely. Thank you for explaining that. That makes a lot of sense. I mean, yeah, radiologists and veterinary teaching hospitals consult long distance, like the Flint Animal Cancer Center where you studied. They consult all over the world with folks. But yeah, there's a vet involved. So now you have this initial visit with the pet, the parent, and the vet. And then after that, I noticed that you offer a pay-per-visit kind of model or a subscription model. Can you explain those two different types?
Yeah, so the difference is basically one of them is, the paper request or conversation. Honestly, I can't think of really the best thing to call it because it's not like just a one comment. It can certainly be a back and forth conversation. But that's where, say a couple months down the road, they do chest x-rays and they want me to take a look at them, or they, something's changed on them. And so they're wondering, should we change the therapy or if the pet's having issues? So those are ways that the vet can actually log into that portal and we can message back and forth that way. So it's not necessarily another live video. There is a recheck option for the video recheck, but that's just a lot more coordinating. So with this, it's more of a quick, like if the vet's been seeing them and then whenever they get a chance to sit down at the computer, they can type up, the notes to me and then I get back to them pretty quickly. So yeah, it's something where it could just be, kind of a per conversation, or if it's a pet that knows is going to be coming back a lot, so maybe like a lymphoma or something that's not doing really well. If the owner and the vet would like to have more contact with me, that's what that subscription would be. So they could contact me multiple times within that month, and it's just one price.
Oh, okay. Okay. That's awesome. Now, does the client pay the veterinarian directly after you bill them, or how does the billing situation work? And then the big question everybody I'm sure wants to know is, what is the price structure? If you can talk about that a little bit, that would be helpful.
Yeah, so the billing, the way all that works. So I actually bill the vet clinic, and that has something to do too with some of the regulations. So as a consultant more to the vet, because they're the ones that have the relationship. So I bill the vet clinic, and then the vet clinic forwards that cost onto the client. So I think of it as like when you send out lab tests, right? So the vet clinic sends out the, whether it's tissue, blood, whatever, to a lab. So the lab charges them, and then they forward that cost onto the client. So to me, it's a similar sort of fee structure.
Okay.
The takeaway I'm hearing is that, if any pet has cancer, dog or cat, the pet parent consults with the local vet, should ask, do you consult with do you have an oncologist on staff? If not, do you consult with one? If not, have you heard of pet cancer care consulting? Let's get an oncologist on board and find out what's going on.
Yes, I think that sounds great. Yeah, that's the way I think of it. I certainly see this as, just another option for people. If they have a local oncologist they can get into, I think that's fabulous. But if it's a situation where they can't, they don't have anyone nearby, or like I said, some of those clients that just aren't sure if they want to see an oncologist, but they really have a lot of questions. So it's just another option for people. And, like you guys had mentioned, a lot of times you're so comfortable with your family vet, you've been going there for years usually, and they know your pet so well. So it's nice. They don't, clients don't have to go to a whole new place, meet all these new people. Right. It's just kind of more of an easy, comfortable setting.
And the oncology part of it can be so overwhelming and just, make people bleary-eyed. It's really great how you're connecting with the veterinarian and the patient and the client at the same time, so they can kind of get that translated and work with a vet that they're normally working with to feel comfortable.
Right.
Yeah. Yeah, we love what you're doing. We just love it. And I know that I personally think the sky's the limit. And can we replicate you like 100 times? I mean, do you plan on adding more teammates?
I do. Yes,
Oh, cool.
I agree. I think, yeah, there's certainly a limit to how many I could see, right? So then I run into the same problem I had before. So I definitely want to, have other oncologists join the team as we go along. And I think that will help too, somewhat with different time zones, in some ways it might be convenient because out east, so they would probably see like, oh, she stays open really late because my times are so different. But at some point it would be nice, more of the same time. So yeah, my 5-year goal is certainly to have several oncologists working together and, all with that same goal of, okay, how can we partner with the family vet to really gain access to oncology care to all those people that are falling through the cracks?
And real quick, you mentioned time zones in other countries. Tripawds has members around the world. So when it comes to working, and many of those people are in countries that have no access to oncology, if even vets. So are you able to consult outside of the US?
So I believe Canada, but and it's one of those, I think it will be kind of a per country.
Case by case.
Yeah, just really trying to read through the records. I'm actually doing a big CE event down in Puerto Rico, which is a US territory. Mm-hmm. But it was funny, a good friend of mine lives down there. And so I was asking her, I'm like, well, can I do this in Puerto Rico? The teleconsulting. So she sends me these documents and has it highlighted, but it's all in Spanish. And I'm like, I'm gonna have to take your word. Like what? Like, I feel like legal documents in English are hard enough to read. And now you're showing me this in Spanish. So but yes, I'm certainly open to it. I think, but like you said, it's a case by case, just unfortunately, yes and no, right? There's legal restrictions. So those always have their pluses and minuses, but I would certainly just have to review it.
So it sounds like the best place to start for anyone is to ask their vet or go to petcarecancerconsulting.com, petcancercareconsulting.com, and right. Work with their vet to get in touch with you.
Exactly. Yes. And the name is a mouthful, but I tried to pick something that really explains what it is.
It says it all.
It says it all. It says it all. That's exactly why we wanted to talk to you. This is such a wonderful service. We cannot thank you enough for what you're doing, Dr. Venable. Thank you very much from all of us.
Oh, well, thank you. It's definitely been a joy talking with you guys. And I really appreciate you having me on your podcast.
And we appreciate what you're doing. Thanks again for your time.
Thank you.
Many thanks to Dr. Venable for the work she's doing to help pet parents around the world coping with a cancer diagnosis. Learn more at petcancercareconsulting.com and find many more helpful resources in the Tripawds blogs and forums at tripawds.com.
He's a three-legged dog and he's still pretty good.